Welcome to the presentation on aeromedicine. In this presentation, we'll have a look at factors affecting the pilot's performance: hypoxia, hyperventilation, middle ear and sinus problems, spatial disorientation, optical illusions, carbon monoxide poisoning, stress, fatigue, alcohol, and decompression sickness. Introduction. It is important for a pilot to be aware of the mental and physical standards required for the type of flying done. This chapter provides information on medical certification and on a variety of aeromedical factors related to flight activities. Health and physiological factors affecting pilot performance. A number of health factors and physiological factors effects can be linked to flying. Some are minor, while others are important enough to require special attention to ensure safety of flight. In some cases, physiological factors can lead to in-flight emergencies. Some important medical factors that a pilot should be aware of include hypoxia, hyperventilation, middle ear and sinus problems, spatial disorientation, motion sickness, carbon monoxide poisoning, stress and fatigue, dehydration, and heat stroke. Other subjects include the effects of alcohol and drugs, anxiety, and excess nitrogen in the blood after scuba diving. Hypoxia. Hypoxia means reduced oxygen, or not enough oxygen. Although any tissue will die if deprived of oxygen long enough, usually the most concern is with getting enough oxygen to the brain, since it is particularly vulnerable to oxygen deprivation. Any reduction in mental function while flying can result in life-threatening errors. Hypoxia can be caused by several factors, including an insufficient supply of oxygen, inadequate transportation of oxygen, or the inability of the body tissues to use oxygen. The forms of hypoxia are based on their causes: hypoxic hypoxia, hypemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Hypoxic hypoxia is as a result of insufficient oxygen available to the body as a whole. A blocked airway and drowning are obvious examples of how the lungs can be deprived of oxygen, but the reduction in partial pressure of oxygen at high altitude is an appropriate example for pilots. Although the percentage of oxygen in the atmosphere is constant, its partial pressure decreases proportionately as atmospheric pressure decreases. As the aeroplane ascends during flight, the percentage of each gas in the atmosphere remains the same, but there are fewer molecules available at the pressure required for them to pass between the membranes in the respiratory system. This decrease in number of oxygen molecules at sufficient pressure can lead to hypoxic hypoxia. Hypemic hypoxia occurs when the blood is not able to take up and transport a sufficient amount of oxygen to the cells in the body. Hypemic means not enough blood. This type of hypoxia is as a result of oxygen deficiency in the blood, rather than a lack of inhaled oxygen, and can be caused by a variety of factors. It may be due to reduced blood volume, due to severe bleeding, or it may result from certain blood diseases such as anemia. More often, hypemic hypoxia occurs because hemoglobin, the actual blood molecule that transports oxygen, is chemically unable to bind oxygen molecules. The most common form of hypemic hypoxia is CO poisoning. Hypemic hypoxia can also be caused by the loss of blood due to blood donation. Blood can require several weeks to return to the normal following a donation. Although the effects of the blood loss are slight at ground level, there are risks when flying during this time. Stagnant hypoxia means not flowing, and stagnant hypoxia results when the oxygen-rich blood in the lungs is not moving, for one reason or another, to the tissues that need it. An arm or leg going to sleep because the blood flow has accidentally been shut off is one form of stagnant hypoxia. This kind of hypoxia can also result from shock, the heart failing to pump blood effectively, or a constricted artery. During flight, stagnant hypoxia can occur with excessive acceleration of gravity, or G's. Cold temperatures can also reduce circulation and decrease the blood supply to extremities. Histotoxic hypoxia is the inability of the cells to effectively use oxygen. Histo refers to tissues or cell, and toxic means poisonous. In this case, enough oxygen is being transported to the cells that need it, but they are unable to make use of it. This impairment of cell respiration can be caused by alcohol and other drugs, such as narcotics or poisons. Research has shown that drinking 1 ounce of alcohol can equate to an additional 2,000 feet of physiological altitude. Symptoms of hypoxia. High-altitude flying can place a pilot in danger of becoming hypoxic. Oxygen starvation causes the brain and other vital organs to become impaired. One noteworthy attribute of the onset of hypoxia is that the first symptoms are euphoria and a carefree feeling. With increased oxygen starvation, the extremities become less responsive and flying becomes less coordinated. The symptoms of hypoxia vary with the individual, but most common symptoms are cyanosis, headache, decreased reaction time, impaired judgment, euphoria, visual impairments, drowsiness, lightheaded or dizzy sensations, tingling in fingers and toes, numbness. As hypoxia worsens, the field of vision begins to narrow, and instrument interpretation can become difficult. Even with all these symptoms, the effects of hypoxia can cause a pilot to have a false sense of security and be deceived into believing everything is normal. The treatment for hypoxia includes flying at lower altitudes and or using supplemental oxygen. All pilots are susceptible to the effects of oxygen starvation, regardless of physical endurance or acclimatization. When flying at high altitudes, it is paramount that oxygen be used to avoid the effect of hypoxia. The term time of useful consciousness describes the maximum time the pilot has to make rational, life-saving decisions and carry them out at a given altitude without supplemental oxygen. As altitude increases above 10,000 feet, the symptoms of hypoxia increase in severity, and the time of useful consciousness rapidly decreases. This slide gives you the comparison. At 20,000 feet, you have roughly 30 minutes or more before the effects of hypoxia would come into play. At a cruising altitude of 45,000 feet, that time is reduced down to between 9 to 15 seconds. Hyperventilation. Hyperventilation is the excessive rate and depth of respiration leading to abnormal loss of carbon dioxide from the blood. This condition occurs more often amongst pilots than is generally recognized. It seldom incapacitates completely, but it causes disturbing symptoms that can alarm the uninformed pilot. In such cases, increased breathing rate and anxiety further aggravate the problem. Hyperventilation can lead to unconsciousness due to the respiratory system overriding mechanism to gain control of breathing. Pilots encountering an unexpected, stressful situation may subconsciously increase their breathing rate. If flying at high altitudes, either with or without oxygen, a pilot might have a tendency to breathe more rapidly than normal, which often leads to hyperventilation. Since many of the symptoms of hyperventilation are similar to those of hypoxia, it is important to correctly diagnose and treat the proper condition. If using supplemental oxygen, check the equipment and flow rate to ensure the symptoms are not hypoxia related. Common symptoms of hyperventilation include visual impairment, unconsciousness, light-headed or dizzy sensation, tingling sensations, hot and cold sensations, and muscle spasms. The treatment for hyperventilation involves restoring the proper carbon dioxide level in the body. Breathing normally is both the best prevention and the best cure for hyperventilation. In addition to slowing the breathing rate, breathing into a paper bag or talking aloud helps to overcome hyperventilation. Recovery is usually rapid once the breathing rate is returned to normal. Middle ear and sinus problems. During climb and descents, the free gas formerly present in various bodily cavities expands due to a difference between the pressure of the air outside the body and the air inside the body. If the escape of the expanded gases is impeded, pressure builds up within the cavity and pain is experienced. Trapped gas expansion accounts for ear pain and sinus pain, as well as a temporary reduction in the ability to hear. The middle ear is a small cavity located in the bone of the skull. It is closed off from the external ear canal by the eardrum. Normally, pressure differences between the middle ear and the outside world are equalized by a tube leading from inside each ear to the back of the throat on each side, called the eustachian tube. These tubes are usually closed, but open during chewing, yawning, or swallowing to equalize pressure. Even a slight difference between external pressure and middle ear pressure can cause discomfort. During a climb, middle ear air pressure may exceed the pressure of the air in the external ear canal, causing the eardrum to bulge outward. Pilots become aware of this pressure change when they experience alternate sensations of fullness and clearing. During descent, the reverse happens. While the pressure of the air in the external ear canal increases, the middle ear cavity, which equalizes the lower pressure at altitude, is at a lower pressure than the external ear canal. This results in the higher outside pressure, causing the eardrum to bulge inward. This condition can be more difficult to relieve due to the fact that the partial vacuum tends to constrict the walls of the eustachian tube. To remedy this often painful condition, which also causes a temporary reduction in hearing sensitivity, pinch the nostrils shut, close the mouth and lips, and blow slowly and gently in the mouth and nose. This procedure forces air through the eustachian tube into the middle ear. It may not be possible to equalize the pressure in the ears of the pilot if the pilot has a cold or ear infection or a sore throat. A flight in this condition can be extremely painful, as well as damaging to the eardrums. If experiencing minor congestion, nose drops or nasal sprays may reduce the risk of a painful ear blockage. Before using any medication, check with an AME to ensure that it will not affect the ability to fly. Sinus block can be avoided by not flying with an upper respiratory infection or nasal allergic condition. Adequate protection is usually not provided by decongestion sprays or drops to reduce congestion around the sinus openings. Oral decongestants have side effects that can impair pilot performance. If a sinus block does not clear shortly after landing, a physician should be consulted. Spatial disorientation. Spatial disorientation specifically refers to the lack of orientation with regard to position, attitude, or movement of the airplane in space. The body uses three integrated systems working together to ascertain orientation and movement in space. Vestibular system are the organs found in the inner ear that sense position by the way of balance. Somatosensory system, nerves in the skin, muscles and joints, which, along with hearing, sense position based on gravity, feeling, and sound. Visual system, the eyes, which sense position based on what is seen. All this information comes together in the brain, and most of the time the three streams of information agree, giving a clear idea of where and how the body is moving. Flying can sometimes cause these symptoms to supply conflicting information to the brain, which can lead to disorientation. During flight, in visual meteorological conditions, VMC, the eyes are the major orientation source and usually prevail over false sensations from other sensory systems. When these visual clues are removed, as they are in instrument meteorological conditions, or IMC, False sensations can cause the pilot to become disorientated. The vestibular system in the inner ear allows the pilot to sense movement and determine orientation in the surrounding environment. In both the left and right inner ear, 3 semicircular canals are positioned at approximately right angles to each other. Each canal is filled with fluid and has a section full of fine hairs. Acceleration of the inner ear in any direction causes the tiny hairs to deflect, which in turn stimulates nerve impulses, sending messages to the brain. Prevention is usually the best remedy for spatial disorientation. Unless a pilot has many hours of training in instrument flight, flight should be avoided in reduced visibility or at night when the horizon is not visible. A pilot can reduce susceptibility disorientating illusions through training and awareness, and learn to rely totally on flight instruments. Graveyard spiral. As in other illusions, a pilot in a prolonged, coordinated, constant rate turn will have the illusion of not turning. During the recovery to level flight, the pilot will experience the sensation of turning in the opposite direction. The disorientated pilot may return the aircraft to its original turn. Because an aircraft tends to lose altitude in turns, unless the pilot compensates for the loss of lift, the pilot may notice a loss of altitude. The absence of any sensation of turning creates the illusion of being in a level descent. The pilot may pull back on the controls and attempt to climb or stop the descent. This action tightens the spiral and increases the loss of altitude. The illusion is referred to as a graveyard spiral. At some point, this could lead to a loss of aircraft control. The sensation that leads to illusions during instrument flight conditions are normal perceptions experienced by pilots. These undesirable sensations cannot be completely prevented, but through training and awareness, pilots can ignore or suppress them by developing absolute reliance on the flight instruments. As pilots gain proficiency in instrument flying, they become less susceptible to these illusions and their effects. Optical illusions. Of the senses, vision is the most important for safe flight. However, various terrain features and atmospheric conditions can create optical illusions. These illusions are primarily associated with landing, since pilots must transition from reliance on instruments to visual cues outside the flight deck for landing at the end of an instrument approach. It is imperative they be aware of the potential problems associated with these illusions and take appropriate corrective action. The major illusions leading to landing errors are described below. Under normal flight conditions, when there is a visual reference to the horizon and ground, the sensory system in the inner ear helps to identify pitch, roll, and yaw movements of the aircraft. When visual contact with the horizon is lost, the vestibular system becomes unreliable. Without visual reference outside the aircraft, there are many situations in which combinations of normal motions and forces create convincing illusions that are difficult to overcome. Visual illusions are especially hazardous because pilots rely on their eyes for correct information. Two illusions that lead to spatial disorientation are false horizon and autokinesis. They are concerned with only the visual system. False horizon, a sloping cloud formation, an obscured horizon, a dark scene spread with ground lights and stars, and certain geometric patterns of ground lights can provide inaccurate visual information, or false horizon for aligning the aircraft correctly with the actual horizon. The disorientated pilot may place the aircraft in a dangerous attitude. Autokinesis. In the dark, a stationary light will appear to move about when stared at for many seconds. The disorientated pilot could lose control of the aircraft in attempting to align it with false movements of this light, called autokinesis. Runway width illusion. A narrower than usual runway can create the illusion the aircraft is at a higher altitude than it actually is, especially when the runway length to width relationships are comparable. The pilot who does not recognize the illusion will fly a lower approach, with the risk of striking objects along the approach path or landing short. A wider than usual runway can have the opposite effect, with the risk of the pilot leveling out the aircraft high and landing hard or overshooting the runway. A narrower than usual runway can create the illusion that the aircraft is higher than it actually is, leading to a lower approach. An upsloping runway, upsloping terrain, or both can create an illusion that the aircraft is at a higher altitude than it actually is. The pilot who does not recognize this illusion will fly a lower approach. Downsloping runways and downsloping approach terrain can have the opposite effect. Featureless terrain illusion. An absence of surrounding ground features, as in an over-water approach, over darkened areas, or terrain made featureless by snow, can create an illusion the aircraft is at a higher altitude than it actually is. This illusion, sometimes referred to as the black hole approach, causes pilots to fly a lower approach than desired. Water refraction. Rain on the windscreen can create an illusion of being at a high altitude due to the horizon appearing lower than it is. This can result in the pilot flying a lower approach. Haze. Atmospheric haze can create an illusion of being at a greater distance in height from the runway. As a result, the pilot will have a tendency to be low on the approach. Conversely, extremely clear air can give the pilot the illusion of being closer than he or she actually is, resulting in a higher approach, which may result in an overshoot or go-around. The diffusion of light due to water particles on the windscreen can adversely affect depth perception. The lights and terrain features normally used to gauge height during landing become less effective for the pilot. Fog. Flying into fog can create an illusion of pitching up. Pilots who do not recognize this illusion will often steepen the approach quite abruptly. Carbon monoxide poisoning. Carbon monoxide is a colorless and odorless gas produced by all internal combustion engines, attaching itself to the hemoglobin in the blood about 200 times more easily than oxygen. Carbon monoxide prevents the hemoglobin from carrying oxygen to the cells, resulting in hypemic hypoxia. The body requires up to 48 hours to dispose of carbon monoxide. If severe enough, the carbon monoxide poisoning can result in death. Aircraft heater vents and defrost vents may provide carbon monoxide a passageway into the cabin, particularly if the engine exhaust system has a leak or damage. If a strong odor of exhaust gases is detected, assume that carbon monoxide is present. However, carbon monoxide may be present in dangerous amounts even if no exhaust odor is detected. Disposable, inexpensive carbon monoxide detectors are widely available. In the presence of carbon monoxide, these detectors change color to alert the pilot to the presence of carbon monoxide. Some effects of CO poisoning are headache, blurred vision, dizziness, drowsiness, and or loss of muscle power. Anytime a pilot smells exhaust odor, or at any time that these symptoms are experienced, immediate corrective action should be taken. These include turning off the heater, opening fresh air vents and windows, and using supplementary oxygen if available. Tobacco smoke can also cause carbon monoxide poisoning. Smoking at sea level can raise the carbon monoxide concentration in the blood and result in physiological effects similar to flying at 8,000 feet. Besides hypoxia, tobacco causes diseases and physiological debilitation that are medically disqualifying for pilots. Stress. Stress is the body's response to physical and psychological demands placed upon it. The body's reaction to stress includes releasing chemical hormones such as adrenaline into the blood and increasing metabolism to provide more energy to the muscles. Blood sugar, heart rate, respiration, blood pressure, and perspiration all increase. The term stressor is used to describe an element that causes an individual to experience stress. Examples of stresses include physical stress, noise, or vibration, physiological stress, such as fatigue, and psychological stress, difficult work or personal situations. Stress falls into two broad categories: acute, which is short-term, and chronic, which is long-term. Acute stress involves an immediate threat that is perceived as danger. This is the type of stress that triggers a fight or flight response in an individual, whether the threat is real or imagined. Normally, a healthy person can cope with acute stress and prevent stress overload. However, ongoing acute stress can develop into chronic stress. Chronic stress can be defined as a level of stress that presents an intolerable burden, exceeds the ability of an individual to cope, and causes individual performance to fall sharply. Unrelenting psychological pressures such as loneliness, financial worries, and relationship or work problems can produce a cumulative level of stress that exceeds a person's ability to cope with the situation. When stress reaches these levels, performance falls off rapidly. Pilots experiencing this level of stress are not safe and should not exercise their airman privileges. Pilots who suspect they are suffering from chronic stress should consult a physician. Fatigue. Fatigue is frequently associated with pilot error. Some of the effects of fatigue include degradation of attention and concentration, impaired coordination, and decreased ability to communicate. These factors seriously influence the ability to make effective decisions. Physical fatigue results from sleep loss, exercise, or physical work. Factors such as stress and prolonged performance of cognitive work result in mental fatigue. Like stress, fatigue falls into two broad categories: acute and chronic. Acute fatigue is short-term and is a normal occurrence in everyday living. It is the kind of tiredness people feel after a period of strenuous effort, excitement, or lack of sleep. Rest after exertion and 8 hours of sound sleep ordinarily cures this condition. Chronic fatigue, extending over a period of time, usually has psychological roots, although an underlying disease is sometimes responsible. Continuous high stress levels produce chronic fatigue. Chronic fatigue is not relieved by proper diet and adequate rest and sleep, and usually requires treatment by a physician. An individual may experience this condition in the form of weakness, tiredness, palpitations of the heart, breathlessness, headaches, or irritability. Alcohol. Alcohol impairs the efficiency of the human body. Studies have proved that drinking and performance deterioration are closely linked. Pilots must make hundreds of decisions, some of them time-critical, during the course of a flight. The safe outcome of any flight depends on the ability to make the correct decisions and take the appropriate actions during routine occurrences as well as abnormal situations. The influence of alcohol drastically reduces the chance of completing a flight without incident. Even in small amounts, alcohol can impair judgment, decrease sense of responsibility, affect coordination, constrict visual field, diminish memory, reduce reasoning power, and lower attention span. Altitude-induced decompression sickness. Decompression sickness describes a condition characterized by a variety of symptoms resulting from exposure to low barometric pressure that causes inert gases, mainly nitrogen, normally dissolved in the body fluids and tissues, to come out of the physical solution and form bubbles. Nitrogen is an inert gas normally stored throughout the human body in physical solution. When the body is exposed to decreased barometric pressure, as in flying an unpressurized aircraft to altitude or during a rapid decompression, the nitrogen dissolved in the body comes out of solution. If the nitrogen is forced to leave the solution too rapidly, bubbles form in different areas of the body, causing a variety of signs and symptoms. The most common symptom is joint pain, which is known as the bends. This slide gives you the effects that the bend has on different areas of the body. Scuba diving subjects the body to increased pressure, which allows more nitrogen to dissolve in body tissues and fluids. The reduction of atmospheric pressure that accompanies flying can produce physical problems for scuba divers. A pilot or passenger who intends to fly after scuba diving should allow the body sufficient time to rid itself of excess nitrogen absorbed during diving. The recommended waiting time before going to flight altitudes of up to 8,000 feet is at least 12 hours after diving that does not require controlled ascent, and at least 24 hours after diving that does require controlled ascent. The waiting time before going to flight altitudes above 8,000 feet should be at least 24 hours after any scuba dive.